Hello, you all. This is Dr. Rita Rogers Stanley, and I'm coming back today. This is Friday. Yesterday was Thursday. It's the day I do Facebook Live, but I was just so disappointed in that Facebook Live. My connection was terrible. So, and the information that I shared is just so important. I wanted to make sure that you got it. So, what I did, what I'm doing now, or when you see this, I would have recorded this and I'm not going to be long, 10 minutes at the most. But I also created a few PowerPoint slides because I really, really do want you to understand what functional medicine is. It's so vital that you understand functional medicine, traditional medicine, the strengths of both, and whether it would be a good fit. And I believe all of us deserve to have a functional medicine provider, someone who can work along with our primary care to help us be well. So I'm going to share my screen. And again, I'm not going to be long. We're going to hit it. And then you'll have this to refer back to. Okay. So the question, some of the things that I was asking or answering yesterday was, what is functional medicine? How does it compare with traditional medicine? And is it for me? Is it something that would help me? So if you'll just take a look at this slide, and these are the 4 P's of functional medicine. It is personalized. So again, we know that every human is different. No 2 people are alike. Sorry about that. So there's genetic and environmental variations that really drive in functional medicine individual treatments. So the first P is personalized. The second is predictive. So we have really tailored health strategies that are based upon a personalized map of health risk, because everybody's health risks are different with traditional and novel biomarkers. So it's personalized, it's predictive, it's preventive. It's a big part of functional medicine is that it's preventive. It's proactive rather than reactive. It's a shift from illness to wellness, from disease treatment to functional enhancement. And the 4th P is it's participatory. And I love this part of functional medicine because I love being able to empower people to be well, not just telling them, do this, let me write this prescription, but I engage them from the start so people feel empowered and they're more engaged to do what is going to be necessary. I love this slide because it shows you the differences between conventional medicine, kind of the traditional model, which I did for 20 years, and what's called functional or more of an integrative medicine. So in conventional medicine, that's what most people have now with a primary care doctor and some specialists. It's a very generalized approach, and it's disease focused. I think we have to admit that. It's a very disease focused practice of medicine. It's conventional, it's traditional, it treats the symptoms. So when you come in, you see your doctor, you're having symptoms, or they note that you have high blood pressure, then they treat the symptoms, they treat what they are seeing. It really isolates you in the organ systems. And that's why you end up many times getting referred to specialists so often in conventional medicine, because we are trained to kind of isolate organs or systems as opposed to looking at you as an interconnected system, which involves different organs. It focuses on a particular area. So if you go in and you're having chest pain, it focuses on your heart. If you're having leg pain, it focuses in on your joints. And it's very pharmaceutical based. So, when you go in to see a doctor with symptoms, they say you've got hypertension, then you're going to leave with some sort of pharmaceutical. And it really teaches us how to kind of relieve symptoms. Functional medicine is really personalized. I mean, we really do get into your business in the sense that it's not just you coming in with a symptom. We dig into a lot of different parts of your being, the emotional part, the spiritual side, and the physical. So it's very personalized. Prevention is the focus. So our goal is to identify different things that are imbalanced so that we can prevent a future diagnosis. It's very innovative, it's comprehensive. Functional medicine gets to the root cause of an issue. It sees our body as an integrated system, as integrated systems, basically. And so it supports the whole body. You can come in with leg pain, but we're not going to just focus on your joint pain. We've got to look at systems, biological systems, which can contribute to your knee or your joint pain. It really does support the whole body. The basis of, if you want to call it treatment, the basis of improvement or support is around lifestyle and nutrition. And really, we work with clients over the long term. I say to people, when you come to see me, it's not a one-off. You are stuck with me if you choose to be, because it is a journey and things change as we get older. So it's not like you come once, I tell you some things to do, you're gone, bye, see you later. No, we want to have a long-term wellness relationship with you. I mentioned yesterday that in functional medicine, we look at health as a continuum. And this is an interesting slide here because in the center of it, they call it the comfort zone or false wellness. That's the state that many people are in. It's kind of neutral. You may not be feeling anything, but your nutrition is inconsistent, your exercise is sporadic, and your health is not really a priority. So you're kind of in this zone of false wellness. And you can go either way. So if you continue in that false wellness attitude, I don't want to exercise, I don't want to eat right, then you are going to be drifting to that red or orange tip of the arrow. Slowly but surely, your health is going to deteriorate. You'll start getting symptoms. All of a sudden, you're on 2 prescriptions or somebody's recommending surgery. You're losing some of your normal function. And ultimately, you end up with disease, multiple medications, your quality of life is terrible, and you're just limited as to what you can do or do comfortably. If, however, you are stuck in the comfort zone right now, but you're like, no, Dr. Stanley, I'm ready to move forward into health and wellness and vitality, then we help you do that. We help you do that by identifying imbalances, supporting those, talking with you about regular exercise, what is good nutrition. We begin to teach you about what wellness really means. And then ultimately, you find yourself at whatever age, and I tell you, the Stanleys are claiming 120 years, but you're not just alive, but you're alive and well. We call it healthy longevity. Okay, so I want you all to invest in yourselves, get out of that comfort zone, that false wellness. I'm good, I'm okay, because you really aren't. You've made a decision in the comfort zone, in that false wellness zone. You've made a decision either way. I'm going to do what it takes to live a long, healthy life, or I'm not, and I'll end up with a diagnosis. You know, in functional medicine, it's really interesting. You can have one condition, have many causes. For instance, you can have depression. So you might go into your doctor's office and say, you know what, I just feel depressed. And you'll ultimately likely get either a referral to a mental health provider, which is nothing wrong with that, or you may end up on a medication. In functional medicine, when people come in with depression, we have to consider all those green circles are different imbalances or nutritional deficiencies that can lead to depression. And we are able to measure these. So we're measuring your thyroid hormones. We're measuring your vitamin D level. We're measuring you to make sure you're not insulin resistant or pre-diabetic. We say, how many antibiotics have you been taking? Over what period of time? Maybe you've killed off your microbiome, and that can lead to depression. So we know for one condition, it can be caused by many things. The other thing is you can have one cause of many different conditions. So in the right half of the slide, you can see that inflammation, which is measurable, which we measure in functional medicine, inflammation left unchecked or unrecognized can lead to depression, can give you arthritis, can lead to cancer, diabetes, heart disease. So again, functional medicine recognizes that when you have a condition, we have to look for a medley of possible causes. Also, when we find a certain measurement, an inflammatory marker that's high, we have to be aware of the fact we have to control that inflammation so you don't end up with many conditions. This is a little busy, but just suffice it to say that when you look at the branches of the trees in this picture, what you're seeing is where you end up in your primary care doctor's office with these organ system diagnoses. But if you dig deep, if you look at the root before you see the manifestations, if you look at the root, you can see that it's a multifactorial cause that ultimately leads to these organ system diagnoses. So again, we're looking at your mental, emotional, spiritual influences, your genetic predisposition, your experiences, your attitudes, your beliefs, and then all of those lifestyle. Are you sleeping and relaxing? Are you exercising? Are you eating? All of those things work together either to your benefit or to your detriment. And if we can recognize that any of these root causes are present, then we can address it before it blooms into some diagnosis. I wanted to show you an example of what that might look like. So, you may go into the office with thyroid symptoms. What is that? Fatigue, hair dry, falling out, constipated, tired. And when you came to me as a primary care physician many years ago, I would just say you have thyroid dysfunction. And pretty much I would do a little bit of testing, but basically I'd probably send you to the endocrinologist. In functional medicine, when people come in that suggest thyroid problems, then we begin to look for different causes of it, different deficiencies. And in this case, we know that when your thyroid is not working, do you have autoimmunity? What are your thyroid levels? Is your body able to even utilize these thyroid hormones? And then we also look at your diet. We look at your toxin exposure. We look at your environment exposure. So then we come to a decision about how are we going to support these symptoms of thyroid dysfunction. The same for blood sugar, the same for diabetes, I'll say. In mainstream medicine, we just say your blood sugar's high, you're pre-diabetic, you're diabetic. In functional medicine, we say, why is the blood sugar high? Do you have inflammation? Because inflammation can drive up your blood sugar. We also look at your diet. What are you eating day by day by day that could be causing your sugar to run high? Are you exposed to any toxins? What is your environmental exposure? What is your family history? So we really take into consideration all of the things at that root level that can ultimately manifest, in this case, as elevated blood sugar, and we deal with the different components of it. Are we going to let you walk around with blood sugars of 300 and 400? No. We may temporarily have to control your blood sugar, but we're not going to stop there. We're going to look for the root cause and deal with that root cause and ultimately reverse the diabetes, because diabetes is reversible. So it's all about your wellness, folks. And functional medicine is an approach to either maintain your wellness or improve your wellness. Traditional medicine is not bad. Functional medicine is not better than. They really can work together. They should be converging. We should be working together professionally as traditional medical practitioners with a functional medicine practitioner as well. So I'm invested in you. And I want you to know that I am practicing functional medicine now. So this is what I do to help people. I don't just treat symptoms. I don't just prescribe. I really want to get to the root cause of whatever ails you. And generally it's more than one thing. And when we find the right combination of lifestyle, stress reduction, food, eating the right food, supporting you hormonally, and that's my thing. I love hormone support, and I only use plant-based, yam-based hormones. When we get that right combination of lifestyle and other nutrients and food and hormone support, it's just, man, sometimes people can't remember when they last felt so good. So I want you to make sure, and you all know this from my Facebook Live, you can contact me, get a discovery call with me to just kind of get an idea. What does this look like for me, Dr. Stanley? You can do that at my website, ritastanleymd.com. And as soon as you open up that first page of the website, there's an orange button up in the corner and it says book a discovery call. Go ahead and do that. Invest in yourself. Right now, for a limited time, discovery calls are at a good price. So go ahead and take advantage of it now. And ultimately, what I want you to do is find your way, get your mindset to do a comprehensive functional medicine evaluation with all the testing. Also, go to my Facebook page, Rita Stanley, MD, and just like that page. And increasingly, I'll be posting different things there. You'll see my Facebook Lives there. God is so good to us, and He's so merciful. And here we are, still alive, despite a pandemic that has blown through this country and killed almost a million people. We're still alive. We have another opportunity. So again, this is Dr. Rita Stanley. I am so glad. I just wanted to make up for that poor video yesterday and give you some. I'm a visual learner, so now you have a few PowerPoint slides that you can look at and again review about what's this thing called functional medicine. The main thing is somebody who's doing it. So reach out, invest in yourself, get scheduled with me. I can do virtual consultations. I can do in-office consultations in Kansas City and Topeka, Kansas. I'm really excited that over the next 10 to 14 days, I'll be in an office in Topeka, Kansas, which will allow me to incorporate other services into what I've been doing, which is functional medicine, a comprehensive functional medicine practice. So stay tuned to that, Topeka folks. I've always been in Kansas City, will be in Kansas City still once a week. So listen, you all have a good weekend, and I will see you next Thursday.